Getting ready for the meds round. The equipment you'll need will depend on what you are administering, such as tablets, liquids, creams, but also the person's preference. Oral medicines may need medicine spoons, cups, or oral syringes. To clean any equipment, we need to ensure we're washing them in warm, soapy water and leaving all items to air dry. We never dry them with a paper towel or a towel. With syringes, there is often confusion about how often we should change them or how long we should keep them for. As per NICE recommendations, syringes for oral medication can be used until the markings start to fade. To wash an oral syringe, we need to draw some water in and out of the syringe a few times. Items for the medication round should never be washed in a dishwasher or sterilizer. Next, check the medication documents. As well as medicines charts or MAR charts, there may be other medicines documents to refer to, such as administration profiles, body maps for creams and transdermal patches, and also when required protocols. It's important when administering medication that we check the individual's identity. If you don't know the person, ask their name, check the photographs contained on the MAR chart, or ask another member of staff for information. Next, we must always start with the chart. The Medicines Administration Record, more commonly known as the MAR chart, lists and records the medicines a person takes or uses. The exact way you work with the medicines chart will depend on the format of the chart you use, whether it's paper or electronic, and also the individual design. It may sound obvious to check the MAR chart first. However, once you've administered medicines to the same person a few times, there is temptation to not start with the chart, as you will quickly learn what medicines they have. This is where mistakes happen. Doses and directions may change, medicines might have been stopped, or new medicines added and prescribed. Hence, we make the following checks. We check to see how many charts there are. We then check to see which medicines are due at that time. We then check to see if any medicines need to be given with or without food. We also check to see if the dose has already been given or taken. We then check to see if the last dose was recorded correctly and that sufficient time has passed before we administer the medication again. We need to remember to carry out the 7-point check prior to administering medicines. Number 1, check the client's name. Number 2, check the name of the medicine. Number 3, check the strength of the medicine. Number 4, check the form of the medicine. Number 5, check the directions. This could be take one daily. Step 6, check the medicines inside. Step 7, check the expiry date. Prior to each medication round, ensure you wash your hands thoroughly under warm running water with soap and dry your hands with either a hand dryer or a paper towel. As normal, staff members administering medication should be bare below the elbow, meaning short sleeves, no wristwatches, and a plain wedding band is acceptable. Staff members should never have nail varnish or false nails. Prior to each medication round, the trolley needs to be clean. We can clean our medication trolleys using either surface disinfectant wipes or antibacterial spray and a correct colour-coded cloth. Following each medication round, the trolley needs to be wiped down. Once the trolley is clean, we must prepare it with the appropriate equipment. Sufficient amount of water, cups or beakers, disposable medication pots, syringes, giving spoons, and antibac hand gel. Designated individuals will have the key to the medication trolleys. The medication trolley should never be left unlocked and unattended at any time. Questions are often asked whether gloves need to be used during the administration of medication. Gloves are needed if you come into contact with blood, bodily fluids, or broken skin. Gloves are not needed if you are administering oral medication or for eye or ear care, so long as there are no secretions present. Secretions could indicate that there is an infection. However, NICE guidelines recommend we need to take an extremely cautious approach and wear gloves if handling any cytotoxic medicines used to treat cancer. Gloves must be worn if applying topicals such as creams and ointments. Many people find it difficult using inhalers. The most common type of inhaler is called an MDI, which stands for meter dose inhaler. Many people find it hard using MDIs as you need to start breathing in first and then press the top of the inhaler just afterwards. Getting the coordination right can be tricky. You also need to breathe in at the correct speed. Too quickly and the inhaler mist hits the back of your throat. Too slowly and the mist just shoots out of the top of the inhaler. You also need to hold your breath for 5 to 10 seconds, which not everyone finds easy. Hence, it's often easier to use a spacer device. The spacer device will depend upon the prescription from the GP. Aero chambers have a whistle on them, which sounds if the person is breathing in too fast. To clean a spacer device, it must be washed in warm, soapy water. After cleaning, rinse the soap bubbles off the outside of the spacer, but do not rinse the inside. When the spacer dries, the bubbles burst, leaving an invisible coating of soap on the inside. This reduces static electricity, which makes the spacer work more effectively. If used regularly, spacer devices should be replaced every 6 to 12 months and should be replaced following a chest infection. Prior to administering inhaler, there are certain checks we have to complete. Firstly, remove the lid and check there are no foreign objects inside the mouthpiece. Secondly, test the inhaler. If the inhaler hasn't been used for 7 days, shake it first and then spray 2 puffs of the inhaler into the air. This ensures the person gets a full dose of the drug. Insert the inhaler into the spacer. If you are using an aero chamber, you might need to twist the rubber end around so that the inhaler is pointing upwards at 12 o'clock. Face mask inhalers can also be twisted. Ideally, the person should be sat upright or standing when administering inhaler. When putting the spacer into the client's mouth, to ensure a good tight seal, it's advised the client is told to say "ooh" to ensure the lips seal around the mouthpiece. Between doses of the inhaler, remove the inhaler from the spacer and shake the inhaler twice. Following the use of a preventer inhaler, which is a steroid, it's advised that the person rinses their mouth with water and spits. Alternatively, they could clean their teeth afterwards. This is to reduce the risk of oral thrush.